All right. Okay, you guys. So I have a question, and this goes out to anyone who's ever had a baby or gone through a pregnancy after gastric bypass, RNY specifically. Um, I'm not sure. I know the other surgeries vary a little bit, and how the sleeve doesn't really affect your sugar intake and the way that you metabolize sugar and all that thing, and neither does the band necessarily. So that's kind of why I'm specifically asking the RNYers. So I have coming up today, I have an appointment with my midwives, and it's going to be basically an orientation, because my doctor that I love has now gone on maternity leave. So she will be gone from now until right up before I give birth. Hopefully she'll be back in time to at least be there. I'm really wanting to do a water birth if possible, and so that means that I need to establish myself with the group of midwives here at the hospital that I'm going to deliver at. So that's what I'm going to do today, is to meet the midwives, to talk to them, to do kind of an orientation, to talk about water birth and what my plans are as far as that goes. So, but before my doctor went on her maternity leave, she was telling me that the next major thing coming up for me is going to be the glucose tolerance test. Um, I'm a little frightened of this. I'm actually thinking that I want to decline the test. I know it's a pretty serious test, and they kind of really want you to do it. Even my doctor, who is very versed in my surgery and knows all about how it affects my digestion of sugars, she was still pushing for me to do it anyway, even though it's going to make me sick. Um, so here's my thoughts, and I'm hoping that maybe some of you have gone through this, and maybe there's alternatives to taking the glucose tolerance test, to still be able to, for them to perceive your risk for gestational diabetes. That's what the test is all about. Here's my thoughts though. I'm thinking, okay, so I asked my doctor, and she said that the amount of sugar in the little sugary drink that you have to drink, what the test is you gulp down this little shot, and then you wait for, I think it's 2 hours at first, and then they test and see what your sugar levels are. Something like that. I could be wrong, but um, I asked her exactly how much sugar is in that little shot, and she said that it's 56 grams of sugar. 56 grams of sugar that I would have to shoot down, let alone that gulping down liquid is going to be difficult for me, because, I mean, I can't even gulp down like that much water, and I think that's about how much liquid I'm going to have to drink. I'd have to sip that down. So I'm going to have to shoot it down, keep it down, and then deal with the ramifications of having 56 grams of sugar coursing through my body all at once, because it will make me dump. I'm not a severe dumper, but having said that, I have never, after surgery, ingested 56 grams of sugar at one time. So I'm very nervous about that. I know that my very worst dumping episodes that I've ever had, it's miserable. I get lightheaded, I get dizzy, I get extreme stomach abdominal cramping, I get heart palpitations, I sweat. I pretty much have all this happen, throw up, diarrhea, and then pass out for like an hour, and I have to sleep it off. So imagine doing this in the doctor's office, because it will happen. 56 grams of sugar is going to give me a severe reaction. And I can only imagine what it's going to do to the baby, because if I'm feeling those effects, the baby has to be feeling some of that. I don't know if the placenta has an effect on how much sugar he gets at one time, or if he gets it all like I do, because it dumps all into my system rather than being slowly absorbed. I don't know, you guys. So I'm really worried about this test. One, because it cannot be good to my body to put it through that. Two, it cannot be good for my baby to put it through the trauma of what my body's going through. And three, because I think because of the nature of my surgery in itself, that it is a cure for diabetes for most people, that a lot of people have the surgery to fix their diabetes. I would think that I would be at extremely low risk for gestational diabetes, just because of the way that my My digestive system is now arranged. Wouldn't you think? I mean, I could be wrong. Gestational diabetes could be something completely different on the realm of diabetic phenomena. I don't know. But I just, I don't think putting myself and my baby through that trauma is worth it to take that test for something that is probably such a low risk for me, considering I'm just different. I'm made differently now than most women are that would be taking the test. So I know it's going to be an issue with these doctors that I'm seeing, with the midwives, if I refuse the test, because one, I don't have an established relationship with them yet. I'm just meeting them. And chances are my next appointment on the 23rd of this month is going to be when they are going to want me to take this test. And if I refuse, I don't know that they are going to, just because they don't know me and they don't know how I'm so proactively involved with my healthcare and knowing what's going on with my body, that they might think that I'm just refusing because I don't want to do it, or I don't know. So have any of you gone through this before? I know with every pregnancy you get to that point and they want you to take the glucose tolerance test. So if you have been offered the test or been made to take the test, can you tell me, one, if you took it, two, what kind of reaction it had for your body and for the baby, and do you know if severe dumping affects the baby at all? What he feels, what he goes through when that happens to me? And then three, if there are any other alternatives to taking that glucose test so that they can still get the results they need to be able to predict gestational diabetes without having to ingest all that sugar. So there's my questions. I know it's a big one, and it's been weighing on my mind since like almost the beginning of my pregnancy. I knew it was coming. I knew it was going to be a major issue, a major hurdle I was going to have to overcome. I was either going to have to suck it up, just do it, and deal with the consequences and be in pain and hurt. And I'm not convinced that that's the best option for me. So, all right, guys, if you have the answers, if anybody knows, please let me know. And I will talk to you next time. Bye.